Welcome everyone to this week's Health Talk. My name is Lisa Douglas and I am a nurse by profession, something that I love to do. I'm very passionate about it. I am a master's prepared nurse and I am also board certified in medical surgical nursing, which is my area of specialty, something that I love. I love doing bedside nursing. I love doing education in the hospital. I also love being a nurse leader. But one thing I'm very passionate about also is those that are in the rural areas or the inner cities, that they're educated on health and how to take care of themselves properly. And so today I have a special guest. He is a wonderful man that I admire and respect quite well. We have worked together on medical missions in the island of Jamaica, so he's also very passionate about educating the community on health. And he is a dentist by profession. So I just want to read his bio to everyone. So Dr. Brian Swann graduated from the University of California, San Francisco School of Dentistry. After a 30-year career in public health and private practice, he realized that he would make a greater impact by focusing on community dentistry and public health policy. This decision led him to Boston as the first Joseph L. Henry Fellow in Minority Health Policy. By 2008, he had received certificates in Minority Health Policy from Harvard Medical School and Oral Health Policy and Epidemiology. Most importantly, the Harvard School of Public Health conferred a master's in public health. Dr. Swann is the immediate past chief of oral health for the Cambridge Health Alliance, where he practiced clinical dentistry and conducted the oral physician program within the general practice residency, a model that integrates and builds capacity between oral health, primary care, behavioral health, nursing, and pharmacy. During his tenure, he implemented a shared appointed model, an innovative approach to providing dental care while increasing access to oral health services. Additionally, he was actively involved in acquiring $4.5 million for a multidisciplinary expansion. Dr. Swann now serves as a consultant and will assist with creating a clinical laboratory to further develop the integrated model. As an instructor in the practice of medicine at Harvard Medical School, he assisted with introducing oral health into that curriculum. Dr. Swann was also instrumental in having oral health questions included as part of the medical interview. At Harvard School of Dental Medicine, he is currently the interim assistant dean of diversity, inclusion, and belonging, an assistant professor of oral health policy and epidemiology, a mentor and a member of the Dean's Strategic Planning Committee. Dr. Swann serves as co-chair for the National Dental Association's Global Oral Outreach Committee. He is involved with outreach projects and serving vulnerable populations in Massachusetts, Tennessee, my country, Jamaica, Haiti, East and South Africa. Most recently, he has treated refugee populations in Lebanon and Greece. He has been humbled to receive several awards for his ongoing commitment to community service and global outreach. Most notably, in 2005, the University of California in San Francisco Dental Alumni Association Medal of Honor. In 2008, from the Harvard School of Public Health, the Albert Schweitzer Award, and in 2018, from Harvard School of Dental Medicine, the Dean's Community Service Faculty Award. Ladies and gentlemen, it is a great honor that I introduce to you my friend, my colleague, my mentor, my coach, Dr. Brian Swann. You're muted.
Thank you, Nurse Lisa Douglas, for that kind introduction. And I appreciate the opportunity to be a part of this program. And that is bringing some information to the listeners about oral health. In the area of oral health, we think about teeth primarily, but I like for people to understand that oral health dentistry is not only about teeth, but it's about anything that's taking place in the oral cavity. And therefore, instead of calling myself a dentist these days, for the last several years, I call myself an oral physician. And that is a doctor of the oral cavity who's interested and specializing in the oral cavity, but also interested in overall health. How what is happening in the mouth relates to the rest of the body, how what's happening on the rest of the body is also showing up in the oral cavity. So today's presentation will be about some of the things that people think about, try to give some answers, some solutions as to how they might prevent disease in the oral cavity. Most importantly, to understand that disease in the oral cavity, in your mouth, is also impacting the rest of your body to varying degrees. So that means that you can have disease in the mouth that can affect your teeth. It can affect the soft tissue in your mouth, which is your gums, your tongue, your cheeks, your lips, the roof of your mouth, the mouth and the nasal and the throat area are all connected. But it's also understanding that disease in the mouth is a risk factor for other potential diseases or things that you may have going on in the rest of your body. We know as a people, especially when folks migrate from home and come to America and having to work 2 and 3 jobs to make it in America, oftentimes people stop cooking. You stop cooking, you start eating fast food. And the fast food it tastes good, but what you don't realize about fast food is that it has hormones and it has additives that make you want to eat more. So it creates an addiction. There are hormones that are put in many fast foods, as well as other foods that we buy that is not necessarily fresh food, that also has ingredients that tells your brain that you are not full, and therefore you eat more. So instead of walking up and down the hills of Jamaica or wherever home might be, you're driving a car here in America, you're going from this place to that place, you're moving fast, you don't have time to cook, you eat the fast food, and there you go. Next thing, you have obesity, high blood pressure, diabetes. We see this everywhere in America. So these things are associated with disease in the mouth as well. Let's go to the next slide. So oral health is not just teeth. When I call myself a dentist, you automatically put me in that box that says teeth. I don't want you to put me in that box. I want you to expand your vision, your horizon, to understand that when I start talking about dentistry and oral health, it is teeth, but it's also more than that. So let's just start out with the teeth and get that part out of the way. Next slide. You get 2 sets of teeth. You get your primary or baby teeth that start coming in when you are approximately age 6 months. And by the time you're 6 years old, 7 years old, perhaps on average, you have 20 baby teeth. Now your baby teeth serve the same functions as your adult teeth, but they have one additional function that the adult teeth don't have. Your baby teeth help guide the permanent teeth into position. So if your baby teeth are lost for any reason, then you are going to have your permanent teeth not really knowing where to go. It can be crowded, they can just be out of place. Then you have to spend thousands of dollars, $5,000, $6,000, $7,000 to wear braces. But baby teeth guide the permanent teeth into position. Here's the most important 2 things to remember about baby teeth. 1, you need to keep them clean because you will get decay in baby teeth. Children can have pain, miss school, be irritable, swell, have infections from baby teeth. And it also means that you want to practice prevention, meaning you want to prevent decay by what you eat and how well you keep them clean. The most important time to clean your teeth or your child's teeth is before you go to sleep at night. When you are sleeping, your mouth is drier. The food that we eat creates a plaque that gets on your teeth and around your gums that's acidic. The enamel on your teeth is the hardest material in your body. And this acid in the form of plaque that gets on your teeth every single day, and if you don't get it off your teeth before you go to sleep at night and your mouth is dry, that acid is strong enough to put a hole through the hardest material in the body, which is the enamel. Now think about that. If it can put a hole in through the enamel, the hardest material in the body, what can it do to your intestines and your gut? We call those holes ulcers. And there's other things that can create that. It's also important to know that the earliest age to start taking children to see a dentist, whether it's a general dentist, is 6 months old. You take your children before they're 1 year old in order for the doctor to let you know what to expect and to see what is taking place in that child's mouth to educate you and the child, especially the parent, about how to prevent decay. The decay that we see in children normally comes on the back teeth because you expect your child to clean them. They can't. You have to clean them. And even when your child is 3 and 4 and 5 years old, after they do the brushing, as a parent, you should brush after them to make sure they've gotten those areas in the back. The other thing that you want to know, and we'll talk a little bit more about this, is how to prevent your children from having decay from the things that they drink. Milk has sugar in it. Sodas, juices have tons of sugar in them, and they will cause tooth decay. And that acid is so strong that it can go through the gums and infect and put cavities in baby teeth before they even come out, or we call it erupt. Next. Around the age of 7 years old, this is the baby teeth. Now look at these teeth, nice color. Gum tissue can be pink or it can be pigmented. Your gum can have brown in it, black in it. That's fine because we have pigmented skin. But what I'm looking at here is the teeth primarily. And you notice space between these baby teeth. This is a full set of baby teeth. You want to have space between the baby teeth. Why? Because the permanent teeth are going to be bigger. Permanent teeth are going to be darker in color and they're going to be larger. So this is what we like to see, ideally speaking, on a baby's teeth, is some space because the permanent teeth are going to occupy that space. Next. Now you're going to go from 20 baby teeth, and around the age of between 6 and 7 years old, you're going to have the baby teeth getting loose and coming out. Why do they get loose? Well, they get loose because the permanent tooth is pushing on them, and the root resorbs or it shrinks. And that's why you just get the top part of the tooth, which we call the crown. The roots are normally not there. If the permanent tooth is coming right underneath it, it causes the root to resorb or to shrink away and disappear. And now you just have the top part of the tooth. It gets loose and comes out. That starts between ages 6 and 7 years old and all the way up until the age between 16 and 25 before you get the third molars, the very last molars in the back, which we call wisdom teeth. I don't think wisdom necessarily starts between 16 and 25, but there's probably a few exceptions. Probably nurse is one of those exceptions. You're going to get 32 permanent teeth at 20 baby teeth. And the areas that we see where people get the most problems with permanent teeth is on their first permanent molars, which start coming in at the same time as your new front teeth are coming in, around age 6 and 7. And children are not accustomed to brushing that far. Those are the ones that get cavities in them first and more often. And the problem with that is that those are permanent teeth. And you get children coming in who are 12, 13, 14 years old with severe decay in permanent teeth, and we have to sometimes take them out. That's a shame. And some of you on this call may have had that experience. You pull out a tooth, a permanent tooth with roots on it, on a 12, 13, or 14-year-old, they never, ever want to come back to the dentist again. So you avoid that by good hygiene, brushing and then flossing your teeth before you go to sleep. If you work at night, if you sleep in the day, brush your teeth before you go to sleep. Next. Human beings get 2 sets of teeth. There are other animals that get multiple sets of teeth. A shark, for instance. When a shark loses his tooth because they bit you in the leg, they get another tooth. Just keeps coming. But adults, 2 sets of teeth. Here's a set of permanent teeth. There's 32 of them. You can't see the last ones in the back. But here's a nice set of teeth, nice color. You notice around the gum line, the teeth are a little bit yellow. That's normal. You don't go bleaching that away. It's just normal. Because when your teeth go under gums, the enamel goes away. It's a different material. The enamel is only on the part of your teeth that you can see, and that's called the crown. Some people have gaps between their teeth. Some parts of the world, gaps are considered a sign of beauty. But whatever it is, these are permanent teeth. Next. So since we're talking about things that are happening early in life, let's start with pregnancy. Women who are pregnant are going through serious changes in their body, hormonal changes. They have a human being growing in their womb. And sometimes you can develop something called pregnancy gingivitis. Gingivitis is gum disease. And you notice that it's not on the back teeth, primarily on the front teeth here. But it can happen anywhere in the mouth. It doesn't mean that this person is not taking good care of their teeth. It's a reaction from pregnancy. It's a hormonal reaction. So it is going to make the gums bleed. It is going to make them a little bit more sensitive. And so therefore you have to take care of it. You brush with a soft toothbrush and then you rinse. It can be warm salt water. It can be mixture of water and peroxide. It can be Listerine and peroxide. All those are healthy rinses. But the warm salt water is really good in a case like this one because it reduces the inflammation. So pregnancy gingivitis is the most common oral disease during pregnancy. It happens in 60 to 70% of pregnancy. If you have gingivitis, which is a mild gum disease, before you were pregnant, it's just going to get worse. In other words, it's going to be exacerbated. Progesterone and estrogen changes and decreased immunity cause this increase of gingivitis. Severe conditions require professional cleaning and prescription mouth rinses. And one of the mouth rinses that is most commonly given here is called Periodontitis. Basically, it's a mixture with a peroxide. Next slide. People also can get pregnancy tumors. For no obvious reason, you will get this swelling above a tooth. It's going to bleed. It might be a little bit sore. You can cut it off, but it will come back until the pregnancy is over. So we advise to just keep the area clean, rather wait for the pregnancy to finish its completion, And then this pregnancy tumor will go away. It's not cancerous, it's benign. It has to do with the association of hormonal changes in the female. Next. So pregnancy tumors, the prevalence, as you see here, is very low. Only happens in about 5% of pregnancy cases. It's similar to a pyogenic granuloma, which is just a tumor that's benign. It's caused by an increase in progesterone. It takes place in the gums. It can take place on the tongue, on the palate, which is the roof of your mouth, or the buccal mucosa, which is your cheeks. Is most commonly seen after the first trimester or after the first 3 months. It can grow rapidly and disappears after delivery. The lesions removed during pregnancy are likely to reoccur. So we can cut it away, but it'll come back until the pregnancy is over. It's not something to be alarmed about. But if you already have poor gum tissue and so forth, then the chances of having that become worse occurs during pregnancy. And here's the other thing that is important about pregnancy and gum disease. Women, if you haven't had your teeth cleaned, and if you have become pregnant, get your teeth cleaned, because there's a 25% higher rate of low-term delivery and low birth weight babies. A 25% chance, higher chance that could happen if you have gum disease while pregnant. Low birth weight baby and preterm delivery. So having your teeth clean, having your gums healthy, that's really the thing. It's not the teeth so much as it is the gum tissue being healthy around the teeth while pregnant will reduce that opportunity for low birth weight or preterm delivery. Very important. Share that information with yourself or family members or friends who might be pregnant. Next. So these are some normal findings in the mouth. We sometimes look at things in our mouth and we get scared because everybody, first thing they think about is cancer. Well, the upper left-hand side, you see something. This is way in the back of the mouth. Behind the very last teeth, you'll sometimes see these little, tiny, small white granules. They're called Fordyce granules. They're asymptomatic. They're just natural to have them. It's not a disease. The slide below that, physiologic pigmentation. We talked about that earlier. People who have pigmented skin, which are black people or any people of color, you can also have pigmented gums. There's nothing wrong with that. It's just pigmentation. And for those of you who are worried about having dark skin and out there bleaching your skins, trying to look lighter, understand that the pigmentation is caused by a cell called melanin. And it has been known scientifically, or we know now scientifically, that melanin is one of the most sophisticated cells in the human body, second only to brain cells. So that old story about the blacker the berry, the sweeter the juice, that's real, because melanin is a very sophisticated cell. So hold on to that nice chocolate skin. And then the top right-hand side is linea alba. So if you open your mouth and look at your cheeks on the inside, you'll often see this line. And that line is just natural to have that. It's usually where the teeth kind of meet. Sometimes we bite our cheeks, but we're not talking about biting your cheeks. We're just talking about this natural line that's in the cheeks, usually at the same level where your teeth come together. Another thing is called torus. Torus or tori are bone. You can open your mouth and some people will have it at the bottom of where their teeth are. You can also, on the roof of your mouth, you might have a big tori that sticks out. It's bone. It's hard, it's benign, it's not a cancer or anything like that. And we leave it alone unless you need to wear dentures. And if it's in the way for wearing dentures, then we cut it away, wait for it to heal, and then build a set of dentures that will go over the gum tissue and won't have that interference. There are other things in the mouth too that look strange to people, but these are just the ones that are often very common that people are concerned about. But these are benign and normal to have them if you do. Next. So now caries is another name for tooth decay. And what causes tooth decay is bacteria that we produce in our mouths every single day. And you add sugar to that, which is in most foods that you eat. It is hard to find any food that is processed that does not have sugar. That creates an acid. Now, this acid in the form of plaque gets on your teeth every single day. You can take your fingernail and scrape your teeth and you get this little white film. That's plaque, and it has acid in it. And when that stays on your teeth, like as we said earlier, it eats through the hardest material in the body, which is the enamel on the top parts of your teeth, and puts a hole in your teeth. Now, these are not gross areas, and we can fix these. The slide on the left shows what's called cervical decay. That's a cavity at the gum line of this tooth. That kind of a cavity are very, very sensitive to temperatures, cold in particular. This kind of cavity we often see for people who are having radiation therapy because they have dry mouth, people who use drugs because they have dry mouth, people who take medicines that can also cause dry mouth, cervical cavities. We can place a filling there to match the color of your teeth. The slide in the middle is brown. You can see that. It's a cavity in between those two teeth. Why? Because this person doesn't floss, or they don't use a toothpick, or they don't use something that cleans between the teeth. And the food, the plaque, stays there until it eats through. We can also come from the back side of the tooth, cut that decay out, and put a tooth color filling in the area like that as well. The key is to catch it while it's small. Catch it young. Because if you don't catch the cavities continue to grow until they get to the heart of your tooth and kill the nerve, and that can often be very painful. The one on the right are showing some molars on the top. The black stains are here, indication that this person has decay. Now, you can have black stains on your teeth and it not be a cavity. It can be coffee stains. It can be from tobacco stains. But these are cavities. Sometimes the dentist has to test it to find out if it's stained or if it's a cavity. But if it's a cavity, we want to put it under arrest. In other words, we want to stop it. And you stop it by removing the decay and placing a filling. In areas of the world where I have worked, where we may not have the tools or the medications to fill a tooth, there's also a material called fluoride that you can place in an area like that if you can get to it and get inside. And that will stop the cavity from growing. It makes a hard seal and the cavity will not continue to grow, but that's not indefinite. Eventually you'll need to get to a dentist or a dental nurse or a dental therapist and have them put a filling in that tooth that will be a little bit more permanent. Keep in mind that no filling lasts forever. There's nothing that we do in your mouth that stays forever. Now might get lucky, but most fillings, if you got them young over a lifetime, will eventually need to be changed. Most dentures that you wear, your gums will shrink and your dentures will need to be changed. So keep that in mind. Next. Now, we talked about children's teeth. These are baby teeth. This child is only 6 or 7 years old. And they have, on the left, moderate caries or moderate tooth decay. Is the little fadey brown areas that you see on those teeth. And it's cervical decay. It's right at the gum line. If you catch it early, we don't even have to drill on that tooth. We can take a spoon and spoon out the decay and put a medicated filling there that will stop that cavity until these teeth come out naturally, replaced by the permanent teeth. But if you don't bring your child, if you don't have access to a dentist or a dental nurse or a dental therapist, the situation will get worse. Now these teeth on the top, some of them cannot be saved. Now this tooth is going to be removed. Some of them on the edges, if the decay doesn't go to the nerve, we can spoon it out and place a medicated filling there and still keep them until they come out naturally. But if not, they have to be removed. That means there's a chance the permanent teeth will not come in straight. But it also, in more recently, would mean that this child is going to have pain. When this child drinks something cold or hot, they have pain. When this child tries to chew their food, because these teeth can become infected, they're going to have pain. When this child goes to school, they're going to get teased and laughed at, and they're going to develop a complex. And those complexes that take place in our childhood only get bigger as we become adults. What caused these cavities on both of these teeth? Sugar. Where did the sugar come from? Milk. The sugar in milk is called lactose. Sugar is in milk. It doesn't matter if it's breast milk from the mother, breast milk from a cow, breast milk from a goat. All of them have the sugar called lactose. How do you prevent the decay? When the baby goes to sleep, you take the bottle away. As simple as that. You can't let the baby go to sleep with the milk and the bottle in their mouth and the sugar is floating around their mouth all night long. Why does this child not have decay on the bottom teeth? It's because the tongue protects the bottom teeth in most cases. But the worst case I've ever seen, from a little Jamaican boy whose mother and father allowed him to breastfeed until he was 4 years old. He had decay on every single tooth in his mouth. So this is preventable. But this can turn into infections. They can have swelling, they can have an abscess, they can have pain, they can get teased. They are not going to be able to eat properly. All of this can be prevented by taking the bottle with the milk or the breast away from the child when they go to sleep. Now, what we're also recommending, and most of you probably don't know this, is that we're saying now, pediatric dentists and pediatric physicians, is not to give your children juice, especially if it's the kind of juice that you get served up in America. Why? Because it has too much sugar. We were saying initially to dilute the juice. Now we're saying no juice, that your child is either having natural milk or water, period. No juice, too much sugar. Not worth taking the risk. Here's the other thing about sugar. It is addictive. How do I know? Because I'm a chocolate lover. I gotta have it almost every day to feel right. Sugar is addictive. Coffee is addictive. Alcohol is addictive. Tobacco is addictive. So many things that we use for pleasure are addictive, and they have consequences. You don't want to start your child out being addicted to sugar when they get on. That is not the way to reward your child by giving them sugar. It's not even the best way to reward your child to give them a cell phone or even have them all day long on a computer, because all of these things are addictive in one form or another. You have to be careful. Next slide. So what does this look like in the mouth? The slide on the right shows radiograph. These are x-rays. These are x-rays, and every one of those shadows that you see between these teeth is cavities. Why? It's similar to this patient on the left. The clinical caries is showing you all these cervical cavities. When you see something like that, then there's something else going on that's not normal. Either this person has so much sugar in their diet that they eat candy all day long. I had one patient who liked lemon drops. The whole time she would be working an 8-hour shift, she would be sucking on a lemon drop. Candy that's in your mouth that you suck, that's hard candy, and in your mouth for long periods of time does the worst damage. I asked her, how many lemon drops do you have in a day? She said between 25 and 30. Every one of her back teeth had cavities against the side of her teeth that way. You also get these type of cervical caries or cavities when you're having radiation therapy. If you have cancer in the mouth, the neck, the head and neck area, it's going to cause these types of cervical decay. These are also caused from medications, whether they are from drugs, whether they are medicinal prescribed by your doctor, which there are 500 medications on the market today that causes dry mouth syndrome. If your mouth is dry, you're going to get these types of cavities. People who have bulimia, who throw up all that acid, will also get these kinds of cavities. So when a woman or a man who is bulimic and they're throwing up in this acid, the first thing they want to do is go brush their teeth because they don't want that taste in the mouth. That's actually the wrong thing to do because now you're brushing in the acid. Rinse your mouth with water and wait till the acid is gone before you brush. And as I said, there's over 500 medications on the market today that cause dry mouth. And this is what dry mouth caries look like. And as long as your mouth is dry, even when we place fillings there, they're going to pop out. They're not going to stay. So you have to be able to put this fluoride on cases like this to stop the decay. And then the patient has to use rinses like Biotene or something that's going to help keep the mouth moist if you have to take medications that cause xerostomia or dry mouth. Next. Periodontal disease. Periodontal disease, gingivitis, gum disease, the teeth that support you. Your teeth are held together by bone, and what gives nutrition to the bone is this gum tissue that then covers the bone. More people lose their teeth because of gum disease than tooth decay. I'll repeat that. More people lose their teeth as a result of periodontal or gum disease than tooth decay. And particularly Black people, we have less tooth decay because of what we eat normally or the density that might be in our enamel. And many people that I see who especially come from rural areas, when you're up country, I don't care if it's Jamaica, Haiti, or anywhere, we have less tooth decay until we start eating the processed food, much of which you find every day here in America. Not only is it addictive, but it also creates more decay because there's sugar in just about all of it. But more people in the world today lose their teeth from gum disease. It's an infection by germs in the gums around the teeth. It's caused when bacteria and plaque, which we get on our teeth every day, builds between the gums and the teeth. Brushing your teeth is not enough. You have to also clean between them. So either you get a toothpick or you get those little brush things that you can buy in the pharmacy, or you use some dental floss. But you got to get stuff from between the teeth as well as on the surfaces of your teeth. So one of the most common infections in people around the world is gum disease. Now, when we go back to children, we don't see as much gum disease, but they can have it as well. But when we talked earlier about tooth decay is the most prevalent childhood disease in the world. When you have a cavity, it's a disease that grows. Your teeth are living organisms. They have blood vessels and nerves inside your tooth. It starts with a bud, like a seed, and grows. And then it stops growing. But your teeth are alive. So tooth decay is the #1 childhood disease in the world. Most of it is preventable. Next. So when you have healthy gums, the tissue on the left slide number 1 is healthy. You don't see any inflammation. And the brown stuff underneath in the roots of the teeth, that's the bone. Gingivitis is mild gum disease. So you start getting a little bit of plaque and to build up around the tooth, or calculus. When the plaque gets hard, it's called calculus. When it gets hard, you can't brush it off anymore. You have to go to the dental hygienist or the dentist and have them scrape it off. But if you catch it early, it won't get to be so bad. But on this gingivitis, the bone has acted, the gums are being swollen and some a little bit sore. When you start looking at let's go back. All right. When you start looking at periodontitis, slide number 3, now you see more inflammation. The gums are starting to separate from the tooth, and you can look at the brown stuff. The bone is starting to break up. And then when it gets worse, now your roots don't have enough support. The gum tissue has pulled away and creates these pockets. And the bone level is now half of where it used to be. Now this tooth has a serious problem. You can get infections, abscesses, and the tooth can get loose and mobile. If you go back a way, dental specialists can put artificial bone around there and help you and cut away the infected gum tissue. But when it gets to the advanced stages, chances are that you're going to lose that tooth and have to wear some type of implant or a denture or a partial denture or a bridge to replace it. That's if you can afford to replace it, because dental work is expensive and it's the highest out-of-pocket cost of any healthcare profession. Dentistry is expensive. Next slide. So gingivitis is a little milder form, and it's in the gum tissue. It becomes red, swollen, bleeds easy. So when you brush and floss, if you are bleeding, then you have gum disease. Simple as that. It is reversible if you catch it early enough. So if you're flossing and brushing on a regular basis at night before you go to sleep, and if you're having your teeth cleaned at a dental office or a dental hygienist once, twice, 3 times a year, depending on what you need, then you can reverse it. Next. Oh, let's hold on for a second. Gingivitis. Go back one. Let's go back. I want to just look at the part down here at the bottom. Contributing factors. What are some of the systemic problems that contribute to having gum disease? Diabetes, smoking, just getting older, genetic predisposition. If your parents, grandparents have it, then you might also get it. Systemic diseases and conditions. Stress also causes gum disease. Poor nutrition, going through puberty, hormonal fluctuations, whether it's hot flashes or going through puberty, whatever it might be, changes in the hormones. Pregnancy, substance abuse, HIV infection, and certain medications can also cause gingivitis. Medications for stroke, things like that, can also cause this type of inflammation in the mouth. Somebody needs to mute. Next slide. So gingivitis is mild. It looks like this. You just have some redness around the teeth. Your gums may swell a little bit, but the most telltale sign is that when you brush, you have bleeding. It's not your teeth that are bleeding. It's your gums that are bleeding. Next. So periodontitis, we talked about that earlier. The gums separate from the teeth. You lose bone. You get pockets around your teeth. Those are things we've already discussed. So this is what periodontitis looks like. You see the stuff that's growing around the teeth that's brown and crusty looking. You see that the gums become irregular and swollen. You see more gingivitis towards the top teeth, but on the bottom, you have this hard stuff called tartar or calculus. You cannot brush it off now. It has to be scraped off. And I've taken off pieces out of people's mouths that are as big as your fingernail. It's not supposed to be there. When you take it off, the teeth become sensitive because now you've exposed part of the root and it doesn't have enamel to protect it. So your mouth will be sensitive. So patients come back and say, well, after you clean my teeth, it's more sensitive. I say, yeah, but hopefully over time it will heal. The sensitivity will go away, but the cause of the infection is gone. And that's what's more important, is that you don't have the infection that's in your mouth, not only causing you to have bone loss and swelling gums, but also to cause you to have infection like an abscess. This stuff can kill you. It's also not having bad breath. People say, well, I have bad breath because I eat onions. No, if you eat onions, you have onion breath. But if you have a situation like this, you're going to have bad breath because it's bleeding, it's infection, it's got pus in your mouth. Scientific name is exudate, but we know it as pus. When you start thinking about putting your mouth up against somebody who's got pus coming out of their mouth, you think twice before you want to kiss this person or eat after this person. So these are things to think about. So not only do you looking for a partner, you want to check out what condition they are in health-wise. Make sure there's no sexually transmitted diseases, but you also want to understand that the mouth is also clean because of this important factor. The bacteria that causes tooth decay and gum disease is transferable. You can give it to your child. You can give it to your partner. Let me just back up and say that again. The bacteria that causes tooth decay and gum disease is, besides catching it from sugar and lack of good hygiene, it's also transferable from one human to another. So a mother who chews her baby's food before she feeds it to them, or who tastes their food before she gives it to them, or blows it off to cool it down before she feeds her child. If she has exceptional tooth decay and gum disease, that bacteria from that food will make their child predisposed to having the same disease. If your lover and a person that you're sharing saliva with has these type of diseases in their mouths, that bacteria is also transferable to you. Now, you want me to take it a step further for the grown folks on this call? If you're having oral sex, the bacteria or some of the diseases that are sexually transmitted diseases, especially HPV, which is the most prevalent sexually transmitted disease in the world, you therefore can, with certain HPVs, you can acquire oral cancer. So there's a rise in oral cancer among men because they are contracting HPV, not knowing it because you don't really get any signs of it. But some of them, and there's many strands, but there's 2 or 3 strands that can be precancerous. And most people don't know that. And when men go to the doctor for a physical exam, no one checks them for HPV because you can hardly see it. So we don't get checked. But there are 2 or 3 strands of it that can be precancerous. And if you're having oral sexual encounters, then you can develop that in the mouth. cancer, from HPV, from oral sex. Now, I'm saying that to you not to get you upset, but this is information that we need to share. And some people will say, well, you're a dentist. You shouldn't be talking like that. No, I'm an oral physician. And dentists should be talking like that because we are the experts in the oral cavity. Now, you are not going to find a lot of people who are going to preach that to you, but this is important to know because it's your life, it's your children, it's your family, it's your friends, it's your community. This information needs to be shared, whether you like it or not. Next slide. So this is what happens after you have periodontal disease. You say, oh, their teeth grew. No, the teeth lost the bone and the gum tissue that was around them because the periodontal disease ate it away. Now these teeth are a little bit more loose. The chances are that they could lose them, but, you know, hopefully they can save them. But they've had surgery to remove the excess gum tissue, but still they're not doing a great job of keeping them clean. Next slide. So the warning signs are red, swollen, tender gums, bleeding gums while brushing or flossing, gums that seem to be pulling away from your teeth, teeth that are loose or are separating from each other, persistent bad breath or bad taste in your mouth that can go down and make your stomach upset too, a change in the fit of your partial dentures. So if you wear partial dentures that are using certain teeth to hold them in place and they don't fit anymore, then you need to look at the teeth that are supporting the partials that maybe because you're not cleaning them well enough, they have periodontal disease and lost bone. They become loose and mobile, and therefore your partial is going to move around until that tooth finally is lost. Next slide. The risk factors, again, we talked about that earlier, but age, smoking and tobacco, genetics, stress, medications, clenching and grinding your teeth. We live in a stressful world, and as the Bible teaches, people will be gnashing their teeth. It means grinding your teeth. Grinding your teeth can cause them to wear down, and also that pressure can cause you to lose bone around your teeth. Other systemic diseases, cardiovascular disease, rheumatoid arthritis, poor nutrition and obesity, all these are factors that contribute to things that are going to show up in the mouth, causing disease or bone loss. Next. So periodontal or gum disease is a leading cause of tooth loss and may be associated with other chronic diseases, including diabetes and heart disease. Diabetes in America is going to be 1 out of every 4 people are going to be directly impacted by diabetes. Either you're going to have it or somebody in your immediate family is going to have it, but it's going to impact your life. And this is according to the CDC and the World Health Organization. Next. And if you have diabetes, understand that your diabetes, a person with diabetes is not going to heal fast if they didn't as fast and they didn't have diabetes. So diabetic patients are more likely to develop periodontal disease, which in turn can increase blood sugar and diabetic complications. People with diabetes are more likely to have periodontal disease. Now, people with diabetes are more likely to have periodontal disease, but people with periodontal disease is also bidirectional. So the diabetes doesn't get fully resolved because you have inflammation in the mouth 24/7. That's what periodontal disease is. It's a bacteria that's going through the bloodstream. It creates inflammation, and that inflammation is going to impact your diabetes. Your diabetes is going to impact the gum disease because if you have low blood sugar or high blood sugar, you're not going to heal as properly as you would like to. So it's bidirectional. So you got to take care of the diabetes, but you also have to take care of the gum disease. Because if you don't, neither one of them are going to totally resolve. So people with diabetes are more susceptible to contracting infections. And gum disease is considered a complication of diabetes. So diabetic patients, people with gum disease in their mouth, you got to fix both of them at the same time. If you do one without the other, then the other one's not going to get any better. And since diabetes is so prevalent, especially for people who have left home and moved to a place like America and changed your diet under a lot of stress, not having as much time to take care of yourself, diabetes becomes very prevalent. And so does heart disease. So does high blood pressure. They're all associated with one another. You have to take care of all of it. Next slide. So this one, again, talks about gum disease and body health. Let's go to the next one. This one's kind of difficult to read. You guys have the slides. You can use them and keep them and look at this later. It's a little bit easier here, and this is Susie, I call her, but periodontal disease can affect your heart and body. But you also notice that she has a baby in the womb. It also has arthritis, a joint replacement, heart disease. All those things are impacted by gum disease in your mouth. If you're going to have a heart surgery and you have gum disease or any infection in the mouth, the cardiologist is not going to do your surgery. It doesn't mean that you have to go out and get a bunch of implants or anything like that. It just means that you need to have the disease in your mouth treated. So whether it's gum disease or whether it's tooth decay, that needs to be resolved before they're going to do a heart surgery or a joint surgery. If you need a knee replaced or a hip replaced, they're not going to do it unless the disease in your mouth is cleared up, because it's a risk factor that will cause complications. And then, as we stated earlier, being pregnant increases the risk of having low birth weight babies or preterm delivery by 25% if you have gum disease. And then, tooth decay is also a problem. You cannot have that in a state where it could be an infection, because an infection in teeth, if it travels down into your throat or up into the brain, it can create death. People die from toothaches, tooth diseases every year, because it's untreated, and that bacteria floats in different parts of the body. If it goes into your neck, it can cut off your airway and stop you from breathing. If it goes to the brain, it can create infection or in the brain, and that can also cause death. One of the most important cases was the DeMonte Driver case, a 12-year-old boy in Baltimore, Maryland, who couldn't find a dentist who would they could afford to take care of his cavities. And the cavity got worse. He got an infection. It went to the brain. 2 brain surgeries later, he died. It was such an embarrassment to the state of Maryland that the governor and Elijah Cummings, the congressman from Maryland, changed the policy that every child that goes to school in the state of Maryland has to have an oral exam, not only a vision exam and a physical exam, but they also included an oral exam. They've made oral health care more accessible with mobile clinics and so forth, and teaching people how to prevent disease in the schools because of this young boy losing his life. So this is serious business. Next. So all manifestations of systemic diseases. So malnutrition is one of those. Malnutrition contributes to 1/3 of children's deaths around the world. Isn't that serious? People not just having something to eat, but having something nutritious to eat. Because you can eat and have no nutrition in your diet, and it will create something called stunting. You see a kid that's 12 and they look like they're a 7-year-old because they can't grow. Well, that stunting not only affects their bones and their ability to grow to their proper size, but that stunting also affects the brain the same way. So malnutrition is not the same as starvation. It's eating, but not eating food that's nutritious. So 165 million children worldwide are stunted, which impacts brain development and body size. 2 billion people are affected by iodine deficiencies worldwide. So not getting enough iodine in their food would cause mental retardation. Maternal and child health who are undernourished account for 10% of worldwide diseases. 20% of children's death among children under 5 could be avoided by 6 months of breastfeeding. The most nutritious way for your child to build immunity is through the mother's breast milk. Now, we know that that's not always possible. But Western medicine makes people who live in other countries think that it's the way to go and that it's more modern to feed with some of the formulas rather than breast milk. Not so. But if the mother is healthy and can breastfeed their child, it's the healthiest way to go in terms of developing immunity for that child. And it would resolve 20% of the children who die because of malnourishment. Next slide. And sometimes this shows up in the oral cavity. You can look at the tongue, and one of the signs of iron deficiency is having a tongue that has these types of inflammations areas, and you can't find any other reason for it. Next slide. Also, you can find malnutrition from a tongue that has a shortage, a body that has a shortage of iodine. So you can look at the lady's tongue on the left, and you can see how the sides of the tongue, are irregularly shaped. The other thing is that you can have tooth prints on the side of your tongue, but that's something that a doctor has to figure out. Slide on the right, you can barely see them, but those are tooth prints. They have a large tongue, and their prints of their teeth are in their tongue. But on the left, when you start doing other tests on this person, iodine deficiency can also show up in the tongue. It's very difficult to look in the mouth and know exactly what you're looking at without further testing. Next. Then you have vitamin C and vitamin D deficiency. Vitamin C deficiency, all this swelling, person doesn't have a lot of immunity, so they are easily infected. Vitamin D deficiency, your best vitamin D comes from the sun. People of color get sick when they move to places like Boston and New York because they're not getting enough vitamin D. And we come from countries that have warm climates to a cold climate. We cover everything up. You notice that people with white skin are outside with everything is open. They don't wear hats, gloves, a lot of things. They don't have a lot of that. But those of us who have melanin are getting the melanin that protects us from the sun burning us, but it also protects us if we're not getting enough sun from getting enough vitamin D, if we're going to cover that up because we're in cold climates. So the point is that vitamin D is necessary. These teeth, vitamin D affects bones, and it also affects enamel, and that's what you see in these teeth. But vitamin D not only affects the structure in our body, but it also affects our attitude. You notice when you get off the plane going to Jamaica, as soon as you walk off that plane and that humidity hits you and that heat, you know you're back home and you just feel happy all of a sudden. Well, part of that is the vitamin D. When you come up here and you're covered up all the time and you're mad about everything, some of that has to do with the shortage of vitamin D that's affecting our attitude, affects our personality. Interesting. Next slide. So some oral pathology, this is thrush. We know the children get thrush. It's also called candidiasis. It's usually a reaction to medication, things like that, or temperatures. You know that it's thrush because you can wipe it off. It can come back, but it can wipe it off. That's a difference between something else that's going to show on one of the other slides. Next. You can also have the herpes simplex. We get that all the time. It's usually coming from stress, or it could be something that you got from another person. These little blisters are contagious. So that means that if somebody else touches that with their lips, then they can also get it. Herpes, just like genital herpes, is transferable. Abscess also on the other side, very painful, right? You can't have anything spicy. You just hate it. I put aloe vera juice or aloe vera gel on that, and it heals it in half the time. But normally it heals in about 14 days or 2 weeks. We don't know why people get it, but it seems to be associated with stress. That's the one on the right, called an abscess ulcer. 2 weeks duration normally, and if it's still there after 2 weeks, then you need to come in and have a biopsy to make sure that it's not something else growing there that shouldn't be. Next slide. Now, this is leukoplakia. The difference between this and thrush is that this does not wipe off. This is oftentimes associated with HIV. Next slide. And this is oral cancer. Now, you'll notice that the most prevalent place for oral cancer to show up in a human is going to be on the tongue, somewhere on the tongue. It can show up in your gums, it can show up in your cheeks, it can show up anywhere. But the most prevalent place that it shows up is the tongue. When you're brushing your teeth and flossing your teeth, you should also brush your tongue. That's not going to necessarily help this, but you should also do that. But oral cancer can come from things like alcohol is a risk factor, smoking definitely, and tobacco is a risk factor. So are transmitted sexual diseases can also show up this way as well. Next slide. So who gets oral cancer? Anyone can get oral cancer. Heavy drinkers and people who smoke or use other tobacco products, vaping, whatever it might be, have a higher risk of getting oral cancer. Though it is most common in people over the age of 50, new research indicates that younger people may be developing oral cancers related to HPV, human papilloma virus. And that most of the time comes from oral sexual activities. Next slide. A dental abscess is also something that is very common. Sometimes you can have a fistula. A fistula is a swollen area. Pus is inside that. If that is punctured, it will give that person some relief. If it's not punctured, it will just swell and the pressure will cause more pain. The little boy on the right, you can see that he's swelling under his eye. It's from a dental abscess. Normally on a top tooth, the swelling will go into your eye area or your ear area. On a bottom tooth, the swelling will go underneath in your submandibular glands under the chin. It can also go down your neck. When it starts traveling down your neck, you better see somebody quickly to get the tooth out or to get drainage in there so that it doesn't choke you to death by closing off your airway spaces. If it's on a child, the same thing could happen. So it's important to take care of this stuff and not just trust taking antibiotics. Antibiotics does not get rid of the infection. It just makes the infection localized, keep it from spreading. But you still need to deal with the cause of the infection. So I don't care how much it costs. And when you go to the emergency department, most hospital doctors don't know how to take care of it. They're going to give you a pain pill. They're going to give you an antibiotic, and they're going to tell you to find a dentist. Well, you need to find that dentist. The antibiotic will keep it under control, keep it from spreading, but it will not necessarily keep it and make it go away. Put your phone on mute. Next slide. Also, people who wear dentures understand that dentures are not made for a lifetime. You can get your denture relined. So this person, the denture on the right, has been relined, but the relined material has been the temporary material. It's all corroded now. It's got all kinds of bacteria in it. You need to have that all cleaned out because it can cause irritation. And when you look at this mouth on the left, you would, but it's not. It's an irritation from the denture. So the denture either needs to be changed. This denture needs to stay out of this person's mouth until the swelling goes down and heals, and then get a new denture or get a new reline inside your denture. The dentures are not made made to last a lifetime, because as you get older, your tissue, the bone is going to change, and the denture does not change. So either you get a reline inside the denture to correspond to the mouth changes, or you get a new denture. Next slide. So other dental issues, dry mouth, we talked about that, ulcers, infection, cavities, bad breath, all associated with the things that we talked about. Next. So bottom line is that most dental disease is preventable. Brushing after meals help remove tooth debris and plaque trapped between your teeth and gums. Don't forget to include your tongue. Bacteria loves to hide there. So I say brush your teeth, your gums, use a soft toothbrush, always a soft toothbrush. Change your toothbrush every 6 months. Don't share toothbrushes. Rinse your toothbrush off with hot water. There's a lot of bacteria that lives in your toothbrush. Make sure you're flossing, or use something that goes between your teeth. If you don't do it every day, do it at least every other day. Flossing at least twice or once a day helps to remove food particles and plaque between the teeth and along the gum line that your toothbrush can't quite reach. And then you want to swish. Using a mouthwash can help reduce plaque and remove remaining food particles that brushing and flossing missed. If you can't brush and floss, at least rinse your mouth out with water. A good mouthwash to use is a mixture of Listerine and peroxide. Or your dentist can prescribe something like Periodontitis that also has peroxide in it. Those are mouthwashes that will help you. And then, if not, warm salt water rinse is also good to relieve inflammation. Next. So positive oral health habits: brush your teeth at least twice a day, floss at least once, regular clean care for dental appliances. If you wear a denture, get it cleaned on a regular basis. It harbors bacteria. Schedule regular dental visits to have at least your teeth clean, and if you have decay, get it under control early so you don't have to spend thousands and thousands of dollars for implants, crowns, bridges, or dentures. And limit the amount of sugary drinks that you have. The worst sugary drinks out there are the ones that people are taking. The worst soft drink out there right now has tremendous amounts of caffeine and sugar. Has kids bouncing off the wall. You know, it's madness, but that's what people like. But understand the sugar creates an addiction. So be careful what you give your children. Next. And lastly, a healthy mouth is an important part of good oral health. Oral health means overall health. So if your mouth is not clean, then the rest of your body is going to pay for that. So make sure that you understand that all of your healthiness, whether it's mental, physical, or spiritual, is all significant. It all works together. You can't have one without having the other. So try to look at that in those various dimensions. Eliminate the risk factors, watch your habits, control your addictions, do everything in moderation, and you will have a healthier outcome, and you will be a good role model for the family and your community. Thank you.
Thank you so much, Dr. Swann. This is a wealth of information, good information. A lot of people pay thousands of dollars to get this information, but today we had it free, courtesy of a man that is very passionate about educating the community. And so at this time, we're going to ask if anyone has any questions for Dr. Swann. You could just raise your hands, and then we'll allow you to ask questions. Go ahead, Brother Rob.
Yes, very, very powerful presentation. Thank you, Dr. Swann, for that wealth of information that you shared with us this afternoon. So I have a couple of questions, but I'm just going to ask one and then leave the opportunity for other folks to ask their questions as well. And then I'll come back a little later to ask you some more. So for me, I know that I do have some loss of bone and what do you call it, periodontitis, where there is some separation between the
periodontal.
Say it again.
Mm-hmm. Periodontal disease. Yeah.
Okay.
Or just perio.
Okay.
Mm-hmm.
Yeah, so I do have some separation between the actual tooth and the gum. And the last time I did go for tooth cleaning, which was many years ago, I know it shouldn't be so, but they did tell me I had some bone loss. So I'm quite sure that that is occurring within my my mouth there. So what can be done to help to, you know, reverse that or treat that? What can be done with that?
Okay. Well, first of all, we're going to post my email address, which is swandent@gmail.com for people who may have questions down the road. So they're going to put that in the chat, swandent@gmail.com. Thank you for your comments and also for being on the call. It's a pleasure and honor to be able to share this information, and hopefully it will do some good. Your question is a good question. You mind if I ask you your age?
51.
Okay. So at age 51, you're at a point where you start seeing changes in the mouth, and you're going to have some bone loss. But when you go and they measure those pockets and you hear them call off numbers, and they can also give you a printout when you are in your dental office of what those numbers are. Numbers from 1 to 3, not to worry. Number 4, borderline. Number 5 and up, bone loss. It can go up to 8s, 9s, and 10s. And when it gets that high, then it usually signifies potential tooth loss. But if your pockets are, in the moderate range of 4 to 6, then oftentimes 1 is just good hygiene at home. You brushing, flossing, and a good rinse. Having your teeth professionally clean in what's called a scaling and root planing, or a deep cleaning. It's just another way of saying that. So getting a deep cleaning and then returning 3 months later and have them remeasure your pockets to see if some of those pockets have healed and if the gum tissue has tightened up around that tooth or teeth. And so then they would take the measurements again. And those pockets that haven't closed, then there's a couple things that can be done. There's periodontal surgery, and then there's a little bit of bone augmentation where you can actually put artificial bone in those pocket areas. They'll clean them, they'll remove a little excess gum tissue, and then pack bone in there and tell you how to take care of it and see whether or not that will generate some new bone and close those pockets to prevent you from having to lose teeth and the matter getting worse. If you have this, attachments are loose and you got these pockets and stuff is going in there and you can't clean it out, you can also get a water pick, and sometimes that helps flush debris out on a daily basis. But having that deep cleaning is the most important thing to do, and seeing if that tissue will reattach. And that doesn't reattach, it could be that you just remove some of the excess tissue, or it could be that you do that plus having some bone replacement. It's a simple procedure done in the dental office. You don't have to be put to sleep for it. You can just have local anesthetic. Some people who are very nervous about it might want to be put in some mild sedation. After this work like that is done, you can have some sensitivity, because if they've removed some of the excess gum tissue that doesn't want to heal, it's going to expose a little bit of the root of your tooth. And the root of your tooth doesn't have any enamel to protect it. But that sensitivity will eventually go away. So you avoid real cold things for a while. until the sensitivity resolves. But you want to save your teeth, because when we lose our teeth, we lose 60% of our chewing ability. How well you chew your food lends itself to how well you're digesting your food. So your mouth is the first stage of digestion. So you want to keep that. Even wearing dentures, you can't chew everything the way you used to. Now, there's some exceptions to that. That's true. But most people can't chew with the hardness that they need to be able to chew. And as we get older, our gut starts telling us when that food didn't digest properly. So it's very important that you be able to chew your food properly and digest it properly. So those are the things that I would recommend for you.
All right. So just to follow up on that, so last time they told me, due to the fact that my gums were bleeding so bad, they were not able to do the deep cleaning until I got the bleeding of the gums to stop. And they gave me some pills to take, but it didn't stop. So I never went back for the cleaning. So what can we do in that regards?
So what you want to, So what you want to do is do the same thing that you would normally do in terms of how you're cleaning your teeth at home, right? Brushing and flossing. You got to do both. And you got to do it every day. Brush with a soft toothbrush. And get you a good rinse. Now, the doctor can prescribe Peridex, Peridex, something like that. Peridex works. And so you want to be able to have a good rinse. And if you're not going to the dentist and they're not prescribing that for you, because you got to get that from a pharmacy, then you can just take Listerine and peroxide and mix them half and half, 50-50. And use that rinse along with what you're doing, and it will go down. And when that bleeding starts to subside, then get in and have your teeth clean, and that will make them go down even more. You don't need to do the deep cleaning right now, just a regular cleaning, just to remove any debris that you can't brush away, because if you've got tartar around your teeth, you can't brush it off. It's hard, and it has to be kind of scraped off. But that's what you want to do. So rinse out, brush and floss. You'll see the bleeding start going down. Take about a week, and you'll see the bleeding decrease. Get in and have your teeth clean.
Thank you, sir.
Thank you. Pastor Fred Pinnock, I see your hands raised. Do you have a question for Dr. Swann?
Definitely. Good afternoon, Nurse Lisa and Dr. Swann. Great presentation, well informative. There was so much to digest this evening. It's a lot of information on the table. But my question is that I brushed twice a day and I floss every day. And what happened is that I do cleaning twice per year. And what happened, I went to my dentist, and it was probably about 6 months ago. He did a filling on the lower jaw, the right side, lower jaw. And what happened after probably about 3 months, 4 months, and then I started, I weren't able to eat on the lower jaw. It's like, it's become sensitive. So like whenever I eat anything soft on the lower jaw, it's okay. But anytime anything like hard or anything medium hard, then it becomes so sensitive that now I probably can't even eat on the right jaw, lower. What could be the cause of that?
So when you are eating on the right side, you're having sensitivity.
Yes. Anything like hard.
Okay. Okay. And so it could be a lot of things, right? It's hard material, so you can't put serious pressure on it.
No.
The first thing that comes to mind is whether or not you have a filling in that tooth.
Yes. It was filled about 6 months ago.
Okay. So the filling may have cracked. What we hope doesn't happen is that your tooth may have also cracked. So you want to find out, was it a silver filling or one of the tooth-colored fillings?
One of the color filling, just the normal, like the tooth itself. Yeah.
Yeah. So those are composite fillings, and they're nice fillings because they're aesthetically pleasing. They're nice fillings because they don't have mercury in them like the silver ones used to, but they're also very, very hard, and so they are easy to fracture. So it's two things. Either your filling is fractured, which causes you not to do that, or your filling needs to have a cement base underneath it. And sometimes when they put these fillings in, they don't put any cement underneath the filling. And so areas like that can be super sensitive, they need to take the filling out, put a cement base under it, and then put a new filling on top of it. And the worst case scenario is that that your tooth is cracked. If filling was too high or something like that, your tooth could have cracked. And if your tooth is cracked, then the tooth will be lost. You can't fix it. And when I'm talking about crack, I'm not talking about a piece of the tooth fragmented off. No, you can fix that. But if a crack goes through the tooth, and that tooth is gone. Can't save it. And with age and time, we do crack our teeth from time to time, especially depending on the types of things we like to eat. So therefore, to find out which one it is, you have to return to the dentist, let them know that I have to have sensitivity, let them check to rule out that your tooth is not cracked, rule out whether or not the filling is not cracked. And if the filling is not cracked, then if you still have the sensitivity, you need to be able to have them remove the filling and put a cement base on your tooth, and then put the filling on top of the cement base to give you a second layer of protection against pressure, as well as thermal sensitivity, temperature sensitivity.
Thank you so much. Thank you so much, sir. I greatly appreciate it.
You're welcome.
Okay, thank you. Marva, you have a question for Dr. Swann?
Yes, I do. It's just a scenario that I need his opinion on. Good evening again, Doc. I loved your presentation,
Yes,
very informative. Okay, I went to the dentist the other day. Reason being, whenever I drink hot or cold, I have a sensitivity in my tooth. It feels as if it cramps like about 1 or 2 seconds. So I went and before that, I did a filling, and after I got the injection in the mouth, a little bump came up on the spot where they gave me the injection. I don't take it as anything. At times I use my tongue, just go there and play with it and so forth. So when I went to the dentist recently, she said that she's concerned about that little red spot there. So she was explaining to me that, she was asking me if when I eat, it hurts. I told her no. She asks how long does the sensitivity stays. I told her just for a couple of seconds. So what she came up with was that some liquid might be going into the bone that is causing some form of sensation when I drink anything. The bottom point is that she's concerned about that little red bump that she sees on my tooth. She recommended that I see the dentist who looked after me the first instance. So I have an appointment to go back. When I came out the dentist's office, I bought a Sensodyne toothpaste. The night when I came home and started brushing, I think it burst. The bump burst. And it started to bleed. So whatever was inside of it came out. So I'm not feeling that anymore. But the sensitivity is not as strong as before when I use that toothpaste. So it is going away, but there's just a slight little numbness when I drink. But I eat on it. It's not hurting me when I eat or anything. So I'm not sure what is the problem. So I'm just putting it to you for you to give me an explanation. So
the bump, the red bump, was it in between the teeth?
No, it's on the side.
There? Oh, was it down? So it's on the side, in your jaw.
Right, the upper right-hand side
so
of the jaw.
if you could imagine the root of your tooth going up, would it be where the root of the tooth would be, near under the bump?
No, it's not near. It's not near the root, because I feel it. It's not near. It's just at the side, the outer side there.
So it's in your cheek?
Yes, right. That's right.
Yeah.
Right.
Yeah. So, I mean, I'm not sure what that is. It depends on where it's located. In the top part of the cheek, there's also a little duct. It's a little thing that sticks down, and it's a saliva duct. Sometimes they get clogged, and when they open up, then they're okay. The sensitivity in your tooth sounds like two different things, and the sensitivity around your tooth could be around the gum line, where the tooth gum tissue might be shrinking a little bit, and you get sensitivity there. It could be an area where you have some recession of the gum tissue, and it exposes some of the neck of the tooth, which is the root of the tooth, and that sensitivity comes and goes. Sensodyne is a toothpaste that has fluoride in it, and that helps to desensitize areas that are sensitive to temperatures. If it's cold temperatures, really no big deal. If it's hot temperatures, then that's something to be concerned about, because sometimes that means that there could be some infection. But, I'm not sure which that would be. So if the dentist who sees you, the one who saw you previously, or the one who's going to see you, they need to take an x-ray of that area to see if there's any association with the nerve inside that tooth. And you're going back to a previous dentist. What did the previous dentist do on that tooth?
Okay, the one I saw recently, she took 2 x-rays, but apparently she's not sure what to diagnose. So I have another appointment to go back to the original dentist that I would have seen. But as I said, the thing has burst, so I'm not feeling it there anymore.
Okay. All right. Well, then I think that, they're two different things, it sounds like. And so you want to address the sensitivity, but also bring it to his attention. She took x-rays. She didn't see anything. So sensitivity, if it's just some bone loss, it doesn't show up necessarily on the x-ray. The thing that burst, could have been an abscess, but it also could have been a salivary duct that had clogged. Now that you have some relief, but someone with experience needs to look at that to see and rule out whether there's any association with where you had the swelling and the tooth that's nearest that. And he or she might be able to see that in the x-ray, and then again, maybe not. They will also test your teeth by palpating your teeth. That means tapping on it to see if one tooth is more sensitive than another.
Yeah, she did
Make
that.
a note to watch. You don't have to.
Okay. Well, thank you. Good question. Good discussion. So we have a few more questions for you, Dr. Swann. So we have Sister Diane. Do you have a question for Dr. Swann before I read the questions in the chat?
Yes, good afternoon. For the doctor, very informative, a lot to take in at this time. But I have questions I want to ask. Some years ago, I got my teeth filled with, do some filling. And it was good for a while until I went and got my teeth clean. And the person who did the job, it was a terrible experience for me. A matter of fact, it was my teeth pained me for days, and then after he did that, all of a sudden I saw my teeth started to break up. Like the teeth started to break into pieces, and I see feeling pieces was coming off, and then it take a while before the whole. And 1 or 2 times I have to go by dentist to get the remaining part of the teeth come out from whatever it is. Because of that bad experience, because it was very painful and it hurt for days, I actually wanted to go and clean my teeth, but I'm so scared because it was not a good experience. So could you give me some light what caused that or whatever, so forth?
When they clean your teeth, did they clean your teeth by just using an instrument and scaling, or did they use an instrument that was spraying water and vibration and all of that?
They use something
a cavitron.
They use a scraping, and when they finish scrape, then they sprayed some water and whatever it is and so forth. But I don't know why my mouth hurt me for days. And they gave me some antibiotic. It took some days. It was terrible. It was a terrible experience for me. And all the feeling dropped out.
How long has it been between? Mm-hmm. So the fillings that you had, were they fillings around the sides of your teeth? Right at the gum line, right in the front?
They were in the teeth itself, inside. Actually, it's a group of Americans came to St. Vincent and they did it. But I never had any problem. It was good. It was dark filling, dark ones, and it was good. But I just wanted to go and get my teeth clean. So that's why I went to them. Mm-hmm. So after they did whatever, not too long after, I started to feel the filling was coming out and the teeth started to break up. Like it was 3 or 4 teeth. So it eventually break all the teeth. The teeth came out piece by piece. 1 or 2, I had to go by a dentist to get the remaining out because it was just seeing the space and the piece of teeth hold on.
Well, first of all, I would suggest that you go to a different dentist for your cleaning.
Yes,
and
for
have
sure.
someone else do it. If you had fillings there, I don't know if they were permanent fillings or if they were temporary fillings. Temporary fillings are made of a cement and they are easily to break off. Permanent fillings are going to be a little bit stronger, but I would suggest going to someone who's going to be more gentle and explain the situation that you have had previously, and that you want your teeth clean, but you also want it to be done with some finesse. So that's what I would recommend, is you go someplace else to have your cleaning done. I don't know the kind of fillings, and I don't know where those fillings were located on the teeth to comment on how they came off. But whenever your teeth are being cleaned, the person who does the cleaning has to be very conscientious about what fillings you have in your mouth, and they have to work around them and to be careful about that. Yeah. And they have to care about you. When you tell them that it's hurting, they need to stop. If you need some anesthesia, they need to put some anesthesia there so that the experience will be a lot more friendlier and calmer. So if you don't have a person that's going to be that sensitive, then you have to find someone who is.
Okay, thank you.
Don't let it stop you from having your teeth cleaned. Yeah.
Thank you, Sister Diane. Dr. Swann, we have some questions in the chat for you. Somebody asked, what can I use to make my smile wider?
Your smile wider, the least expensive way is to get Crest whitening strips. You can buy those across the counter in any pharmacy. If that doesn't work, you haven't really lost any great deal of money. The next way would be going to the dental office and asking them to whiten your teeth. And what they're going to do, either they have a machine that you sit under that machine for about an hour that whitens your teeth. They're not concerned about whitening all of your teeth in the back. They're usually only wanting to whiten the teeth that are in your smile line. So as big as your smile, that's how far that machine is going to work. Another way of getting the teeth whitened is going to the dentist and having them make custom trays. They're made of plastic, and you fill the trays with a gel, and you put them in your mouth, and you walk around the house with them like that for a couple of hours. And eventually that will also whiten your teeth. And understand that teeth are not all the same colors. Just like we're not the same color, teeth have different colors. They can have pigmentation, they can have some gray, some yellow in them. They can have some red tones in them. Teeth have various colors. And, I don't mind liking seeing white teeth, but you don't want them to look artificial either, like chiclets. So make sure that when you whiten them, understand that they're not going to stay that color. You have to continuously whiten them to maintain that color. And then you have to also be careful about foods that stain your teeth. So drinking tea, drinking coffee, drinking wine, smoking, all those things are going to cause teeth to stain. So if you don't want to have to bleach them very often, then, you have to cut back on those things. Getting the bleaching trays and then buying the gel, that's probably the best way to do it, because that way you can control it yourself and you can have it at home and use it whenever you want. Sitting under a light to bleach your teeth for an hour, it's going to cost a lot, and your teeth are going to be quite sensitive when the bleaching is finished. Because what the bleaching does, it has peroxide in it, and your enamel is made of little tubes. And these tubes will open up, clog, and that's how come the teeth look lighter. But it makes your teeth sensitive for a few days, so you have to be careful and not eat anything that has extreme temperatures until the sensitivity goes away.
Thank you, Dr. Swann. The next question, in line with that question, is, do the whitening strips remove your enamel?
No, they don't. They have peroxide in them. It doesn't remove your enamel. But what if you have sensitivity, as I say, after you use them, is because it's sort of dissolving the material that's inside tubules, and it's kind of bleaching that out. So that makes the teeth a little bit sensitive afterwards, but it's not removing the enamel itself. It's kind of taking some of the coloration out of the enamel. So, that's what causes sensitivity. It will eventually go away, but it doesn't destroy the enamel.
Okay, thank you. And the next question is, what should my oral hygiene regimen be? How often should I have a dental exam and cleaning?
Well, you should probably, on average, have a cleaning twice a year. You should use a soft toothbrush, floss, or use something between your teeth most nights. I mean, if you miss a one or two, it's not a big deal. You should have an exam probably just once a year. You don't need an exam twice a year.
And what toothpaste do you recommend?
It doesn't really matter. I think that it's just a point of using it. There's natural toothpaste that are out there that don't contain sugar. There's toothpaste that contain fluoride. There's toothpaste that contain baking soda. If you're going to use any of those with baking soda is more abrasive, and you want to make sure you're using a soft toothbrush. Change your toothbrush every 6 months, because when it starts bending over and the bristles become bent, then it's not really helping you. And but it really doesn't matter what toothpaste you use. If you don't have toothpaste, you can use salt, but not every night because it's abrasive. You can use baking soda, but not every night because it's abrasive. And it's better just to use your toothbrush with just water and do something better than doing nothing. But I don't recommend any particular toothpaste. Myself, personally, I like toothpaste that has a little baking soda and peroxide in it. But that's my preference. There's Tom's toothpaste. There's all kinds of toothpaste that are made of natural ingredients. And, they all work fairly well.
Thank you. And I have one more question. It's a statement and a question, so I'll read it to you. So someone stated that I had a filling a few years ago. Before that, I had no issues with my teeth and gums, but after the appointment, I started experiencing sharp, lightning pain in my gums. I also realized they overlooked a few parts of my teeth that was drilled. What could be causing the pain? Could it be related or just a coincidence?
I mean, it can be either one, right? It could be related or it could be a coincidence. A lot of times it's related to something else that's going on. The gum might be a different situation than whatever they did on the teeth. But it's always a good idea sometimes to get a second opinion and actually go to a different dental office and have them to evaluate. Let's say you go in for a checkup and they do a checkup, they take x-rays, and they'll tell you about that particular filling. Is that filling cracked? Did they fill it all the way? Did they leave some spaces that were open? Does the filling go between your teeth and not just on the chewing surface? If it's on the chewing surface, did it crack? You want to rule that out. If it goes down the side of your tooth and in between it and another tooth, it has to be done properly so there's no overhang, extra filling material that's sticking out, or it's a space there so it's a food trap. All those things will cause the gums to get infected in that area of the filling if it goes between your teeth. So it needs to be looked at. Just because you have a filling doesn't mean it's working properly. So there's stuff that can go wrong or it can be done poorly.
That was my final question. Thank you so much again, Dr. Swann, for being with us today. Thank you, everyone, for joining. I'm going to encourage you to go to my YouTube channel. It is Nurse Lisa Douglas. Please comment, share, like, subscribe. Make sure you hit the notification button so that whenever I have any future live or uploaded videos, you can be made aware of those. Thank you so much. I hope this was a blessing. I know it was a blessing to me. It's a lot of information. I've learned a lot myself as a nurse, and he's my mentor. So I've learned a lot, and he's always teaching me something. I remember him telling me to cut back and eating curry when I had white braces. So he's a wealth of knowledge. And so I thank you so much for your time. Thank you for your patience. Have a wonderful rest of the evening, everyone.